OCD. Hi, welcome to a new video. Today, we're going to talk about an important and often misunderstood topic: obsessive-compulsive disorder, or OCD. This mental health condition can significantly affect our lives, but today I want to help you understand it better, how it manifests, and most importantly, how we can face it in a positive way to improve our well-being and mental health. So if you've ever felt trapped by repetitive thoughts or behaviors, or if you know someone who's experienced this, stay with me, because obsessive-compulsive disorder, OCD, is an anxiety disorder characterized by obsessions and compulsions. While it's often confused with simple habits or quirks, OCD goes far beyond that. It involves intrusive and repetitive thoughts that you can't control, which cause intense anxiety. To try and reduce this anxiety, the person feels compelled to perform certain repetitive behaviors or mental acts. For example, if you're afraid of contamination, you might feel the need to wash your hands over and over again, even though you know they're already clean. Or if you feel like something is out of place, you may check and rearrange things repeatedly, unable to stop yourself. 1. Obsessions: recurrent thoughts, images, or impulses that cause distress or anxiety. 2. Compulsions: repetitive behaviors or mental acts performed to relieve the anxiety caused by the obsessions. OCD deeply affects our well-being, not just emotionally, but physically and mentally. The obsessions and compulsions create a constant cycle of anxiety and stress that can take over a large part of our lives. Imagine living with a constant feeling that something's wrong, that you must do something again and again to prevent something bad from happening. This can impact our relationships, productivity, and self-esteem. When we can't stop the compulsions, we feel frustrated, which only adds to the distress. OCD also interferes with everyday tasks. For example, if you feel the need to check 20 times whether you turned off the lights or locked the door, it takes up time and energy and can create a sense of losing control over your life. People with OCD experience a range of symptoms that vary from person to person, but some of the most common include: 1. Excessive concern with cleanliness or contamination, leading to frequent hand washing or avoiding places seen as dirty. 2. Need for order and symmetry, with a compulsion to organize items in a very specific way, causing anxiety if not done just right. 3. Intrusive violent thoughts or fears of harming others, which can cause guilt, even though these thoughts are irrational and unwanted. 4. Repetitive checking, like checking door locks, appliances, or making sure things are in place, even after knowing they already are. While OCD may feel overwhelming, I want you to know there are ways to treat it. With the right approach, you can experience significant improvements in your well-being. Here are some of the most effective treatment options. 1. Cognitive behavioral therapy, CBT, especially exposure and response prevention, ERP, where you're gradually exposed to your obsessions without performing the compulsions. This helps reduce the anxiety over time and teaches you to tolerate it effectively. 2. Medication. Antidepressants, particularly selective serotonin reuptake inhibitors, SSRIs, are commonly used to treat OCD, helping to balance brain chemicals and reduce symptoms. 3. Emotional support. Talking to a therapist, connecting with others who experience OCD, or joining support groups can be crucial in managing the disorder. It's important to understand that OCD does not define who you are. While it may affect your life, you don't have to face it alone. Here are some key tips to support your personal growth and well-being while managing OCD. 1. Practice self-acceptance. Acknowledge that you have OCD, but don't let it define you. Recognition is the first step toward managing it. 2. Face your fears gradually. Over time and with the right support, you can learn to handle obsessions without letting them control your life. 3. Seek professional help. Don't be afraid to reach out. Whether it's therapy or medication, Getting help is a sign of strength. Mental well-being is essential to living a full and healthy life. Accepting yourself, seeking support, and working on personal growth are all vital steps toward improving your quality of life, even while facing challenges like OCD. So if you feel that OCD is affecting your life or the life of someone close to you, don't hesitate to seek support. OCD is treatable, and with the right approach, you can regain control of your well-being and happiness. If you found this video helpful and feel like it helped you understand OCD better, don't forget to like, subscribe, and hit the bell to receive more content about mental health, motivation, and personal development. See you in the next video.